Okay, to find your results for your CAT test, you'll go to Learning Systems 3.0, you'll go to My Quizzes, and then you'll look for Adaptive Learning Quiz and click on the Review tab. You will see that there are several categories, and it lists which ones you know how many questions you got right, so how many is correct, how many is incorrect, and then so like this particular category, this person got 0 correct in renal and urinary. So the test question that this person would write would be Med-Surg, renal and urinary. Now this is the NCLEX RN test plan, and this document can be used as a blueprint for your NCLEX exam. This is a really big blueprint, just like the blueprints that you get for your exams currently. So this NCLEX test plan is for the NCLEX, but you get to start early using it. So you have a longer period of time than you have your exams, but it is kind of lengthy, but it is done very well and concise. It has like why they created the test plan and that sort of thing, the background, how the introduction to it, like how it was designed, and then the test plan structure. So it's based on client needs, and the content has 4 major client need categories. 2 of the 4 are divided into subcategories. So you have safe and effective care environment, which includes management of care and safety and infection control. And then you have health promotion and maintenance is your second client need. So that's about a lot of teaching and things like that. Psychosocial, as you can imagine, would be mental health. And then physiological integrity, that's where a lot of our content is. It's in basic care and comfort. It's divided into 4 categories of basic care and comfort, pharmacological and parenteral therapies, reduction of risk, and physiological adaptation. So like management of care would be some of the leadership things, and also just managing a client's care, safety, and infection, because you're also managing the care environment. So those are the 4 client needs categories. Major client needs categories. And then it talks about integrated processes, talks about clinical judgment. You'll hear a lot about clinical judgment this semester if you haven't already. So these 6 items are the items that are used to develop this test. And so first, on any topic or any problem, the nurse would recognize cues, meaning she would identify what information was coming in and what was important. Then she would have analyze cues, where she would organize and connect the information to the client's clinical presentation. Then prioritizing hypothesis. This is like the planning stage, evaluating and prioritizing what kind of situation do we have here? What are the time constraints? What's urgent, what's not? So you're going to have the priority frameworks that come into play in this clinical judgment process. And then you have generating solutions, where you use your hypothesis to define a set of interventions for the expected outcomes. And then you're going to take actions, implement the ones that address the highest priority, and then you're going to evaluate the outcomes. Were your interventions effective, or do you need to readdress your hypothesis? So, and it goes in that order. When you have your case studies again, there are 6 questions in every case study, and they will be in this order. So the distribution of content is here, and it kind of diagrams it out for you and shows you that management of care is a big portion of it. That is the majority. Content is 18% of management of care. That's the highest percentage. And then we have next in line is the pharmacological and parenteral therapies is 16%, and reduction of risk 12%, physiological adaptation 14%, safety and infection control 13%, health promotion and maintenance is, like I said, more teaching 9%, and then psychosocial also 9%, basic care and comfort 9%. So you can see how that's divided out. And then there's an overview of the content itself, and just talks about all the sciences that were involved and what thought patterns they're using. And then you have the different categories. So remember, the safe and effective care environment, management of care was in that category. So it talks about activity statements that nurses would do within this category. And so when you're writing your test question, you can choose which category you want to write from. So in the example I gave for the CAT test, the lowest score for that person was in med-surg and renal. So I know that part, but I could put that in any of these categories, right? So the NCLEX is not broken down into body systems as we know it. It's broken down into these 4 categories that we talked about. So I could put renal in here, so I could do, recognize and report ethical dilemmas, code of ethics. So I could write maybe an ethical question about a nurse who is taking care of a client on dialysis and the client refuses the treatment. That would be kind of an ethics question that I could write. Then they have safety and infection control here on down the line, protecting clients and healthcare personnel from health and environmental hazards. So that could be, I could still use renal again, but I could talk about the environment. I could talk about following procedures for biohazardous and hazardous materials. So I could talk about somebody that had gotten radiation, what they do with their urine, or I could talk about educate client on safety issues. So safety issues related to, taking care of a shunt, that kind of thing. So it could still be renal in any of these categories. Health promotion and maintenance is this category. And so a lot of this, again, like I said, is education, as you can see, managing care, but education assessment is the bulk of that category. And then psychosocial is mental health. And then physiological, which is physical health, of course, basic care and comfort. These are the kinds of categories that techs could do. So this is where you're going to find the things that they can do. A tech can do anything that doesn't require assessment, development of a care plan of any kind, education, or medication. So assessment, care planning, medication, or education has to be, at least an LPN and RN has to do it if it involves a new education, a planning, or a admission assessment. So that's the difference in the different categories on the basic care and comfort. So the tech can do a lot of these. They can do postmortem care. They can probably not do skin assessments. They can provide non-pharmacological comfort measures if it's on the care plan, so they can follow the plan of care. So the plan of care that the RN designs is like a nurse order that nurses can do. So techs could do those if they're within their skill set. Pharmacological and parenteral therapies, that's going to be all medication administration, of course. So if you wanted to do renal and you want to do medication, you could just, do a question like that under renal, under pharmacological and parenteral therapies. Reduction of risk potential. This is safety kinds of things, but it can be with lines and tubes that the client has. Medications. Physiological adaptation. This is going to be a lot of your disorders, diseases, and things like that you're caring for. This is more of the body system kinds of things, like respiratory for suctioning, ventilator care, cardiac care, pacing devices, telemetry, that kind of thing. And then here's hemodialysis, that kind of thing. And so that is the end of the categories. Then it talks about the examination length, the passing standard, reviewing answers and guessing. And it says here, examination items are presented to the candidate one at a time on a computer screen. It will not allow you to go to the next question without answering a question. So you do have to select an answer for every question. And the computerized adaptive testing kind of talks about how that works We have another video on that item that talks about pre-test items. So for a CAT to function properly, the difficulty of each item must be known in advance. So the difficulty for one person may be different than the difficulty for another person. So it gives you a few pre-test items. And then the difficulty of those items is unknown in advance, and they're not included when estimating the candidate's ability. When enough responses are collected, the pre-test items are statistically analyzed and calibrated. And then it can move on to the test. There are 15 pre-test items on every NCLEX. So the first 15 questions will be pre-test items. And then it talks about, we've already gone through the passing and failing of NCLEX and the scoring items and things on the previous exam. So I'm not going to go over those again. This is kind of some NCLEX terminology. Unlicensed assistive personnel or nurse techs. They can be known as nursing assistants. They can be known as PCAs, UAPs. There's a lot of different names for them. Some are certified by the board. Some of them are just certified by a VOTEC college. So you might have to find out what their scope of practice is if you're working with techs. It talks about, there's a little tutorial there that you can go to NCLEX.com and take that. And so here's some sample content that it includes for management of care. So there's 8 test plan categories, as we talked about in the little diagram earlier. And it has some sample items here. So it talks about, in all of this management of care, here's some categories, related content that might be under management of care. Delegation, of course, is here. Case management, assignment, delegation, and supervision. Advocacy is here, and advanced directives. And then client rights, collaboration with a multidisciplinary team, concepts of management, confidentiality, information security, and continuity of care. Priorities, ethical practice, informed consent, information technology, legal rights and responsibilities, performance improvement, and referrals. So this is the biggest category. So all of this content is under management of care, and then it gives you a sample question with a key that you can look at. And then let you look at that for a second while we're here. Nurse has been made aware of the following client situation. The nurse should first assess the client with diverticulitis who is reporting left lower quadrant pain. I would expect that with a client with diverticulitis. Then with chronic COPD disease who is reporting hemoptysis. So coughing up a little bit of blood. It doesn't say how much it is. And then you have a client who had an evacuation of a subdural hematoma 8 hours ago and has become agitated. Anytime a client has subdural, would be in the brain. So when a person becomes agitated and they haven't been agitated, that's not their personality normally, that means the brain is not getting enough oxygen, which means that the hematoma could be growing. So that's why that is the most urgent. While this is important, this could be deadly. So this probably isn't going to kill him, but this could. And this last one, a client who had a knee replacement 8 hours ago and whose affected extremity is internally rotated. While that's not a great thing, it's certainly not going to be life-threatening. So again, it would be number 3 would be your answer. So this goes on in the same way. You've got safety and infection control. That's all about protecting the client from injuries. And it's accident error prevention, emergency response plan, ergonomic principles, handling hazardous and infectious materials, home safety, reporting of incident events, so variance reports. That's important. You'll have questions about that. And you also need to know what to do with that as a student and a nurse. So safe use of equipment, security plans, standard precautions. That's important to know what those are. And use of restraints is also very important. And then you have health promotion and maintenance. And health promotion and maintenance, let's get back to that. Somehow we got off of that path. Okay, health promotion and maintenance is where we're at now. And the health promotion and maintenance involves a lot of education and assessments. So when you go, you're going to look at the aging process, intra, and postpartum. Types of assessment, calculating expected delivery date is in that section. Developmental stages and transitions. At what age should they do this or that? What is expected at different parts of the lifespan? And then we're going to look at disease prevention, health screening, high-risk behaviors, and lifestyle choices such as smoking, drugs, alcohol, that sort of thing. Then self-care, techniques of physical assessment. So here's an example question here. It talks about the nurses teaching a client at a community health fair about risk factors for developing cancer. The nurse should recognize that at highest risk is and if you look here at the answer, is 62-year-old client who consumes 5 or 6 alcoholic beverages per day and is an opera singer. So I encourage you to Google the correlation between opera singers and cancer. That's an interesting read. Then psychosocial integrity talks about different types of abuse or neglect, and then grief and loss, anything that affects the mental health is what you'll talk about in that section. Coping mechanisms, crisis intervention, end-of-life care, that sort of thing. Mental health concepts, religion, and spiritual influences on health. Pretty much anything that's not physical is in the psychosocial component. Support systems, etc. So the nurse is talking with a client who had a colostomy created 2 days ago. Which of the following statements by the client would indicate ineffective coping? So we're looking at the answer that would be incorrect. Always when you see ineffective, needs more education, that kind of thing, then you want to look for the incorrect answer. So ineffective coping. So I'm not touching that disgusting bag. Well, that looks like they're not coping very well, obviously, because there's nothing saying that they're accepting that at all. And in number 2, it says, I'm glad I can still go to the gym just as I used to. That's a sign of coping because they're looking forward to something. I really like raw vegetables, and it'd be hard for me to limit them. They're realizing they're accepting the fact that they're going to have to make some life changes. I understand the need for the colostomy, but I am afraid that the bag will leak. Well, that's a normal fear if you've got that situation that could be a potential problem. So they can actually come up with some interventions to prevent that and help alleviate that fear, but that's part of the coping process. And then the number 5, it says, I do not understand why I cannot have a nurse perform the colostomy bag changes for me. There's no evidence of acceptance or effective coping there. So numbers 1 and 5 are ineffective coping statements. They're not effective in that they don't work to help the client cope with that situation that they're faced with. Then we have physiological integrity. That's the physical component of diseases, disorders, and that kind of thing. And it kind of looks at the different categories: assistive devices, elimination, mobility, non-pharmacological comfort interventions, nutrition, hygiene, rest, and sleep. And in this question about dumping syndrome, the foods that should be avoided for dumping syndrome are foods that are very hot or cold, because they can trigger dumping syndrome symptoms. So that's why the ice cream is the correct answer on that one. Then they have pharmacological and parenteral therapies. And that's all about drug administration, side effects, blood products, anything that medication or treatment through the veins would entail. TPN, nutrition through the veins. So here's a question about that one. The nurse is preparing to administer prescribed otic drops to a 1-year-old client. Which of the following actions should the nurse take? Well, you want to direct the drops along the side of the ear canal to avoid instilling the medication directly into the eardrum. So you'll point towards the side of the ear, of course on the inside of the side of the ear. And you pull the pin actually downward and straight back to straighten the auditory canal. Immediately after removing them from the refrigerator, that wouldn't be good because they'd be really cold. You want to let them warm up a little bit before instilling them. And you don't need to massage the area immediately posterior to the ear after instilling the drops. You would actually do it in front of the ear. Then we have reduction of risk potential. And so this is just reducing, kind of planning ahead and doing things to prevent illness or injury, and to identify changes that would indicate illness or injury, potential complications, all of that kind of thing. Therapeutic procedures. So then the sample item, it has the nurse is caring for a client who is scheduled for a lumbar puncture. It would be most important for the nurse to assess the client for, and since that's in the spinal canal and the spinal fluid is there, so we would want to assess them for signs of increased ICP. The Trousseau sign is related to calcium, bowel and bladder function. Would it be part of that? Circulation, movement, and sensation of the legs. That is unlikely that you'll have nerve damage, but they are doing some things with the spinal fluid, which does impact the intracranial pressure. So that's why number 3 would be the answer there. And then physiological adaptation. So that has to do with how clients are adapting to different things that happen to them related to their condition or to procedures. Hemodynamics, fluid and electrolyte balances, illness management, emergencies, unexpected response to therapies. So in this one, the sample item says the nurse is assessing a client with viral meningitis. Which of the following findings would the nurse expect to observe? Select all that apply. So with viral meningitis, you're going to have nausea, vomiting, and photophobia. So those are the symptoms related to viral meningitis, which are different than bacterial meningitis. It's good to know the difference between those two. Okay, that is your NCSBN test plan in its entirety. I try to keep these videos pretty short. This one's a little longer than normal, but this is an important thing that you'll need to start working on now because it is part of your blueprint for your NCLEX exam.